Hello and welcome to the FDM Academy. Today I wanted to talk about the difficulties of research in the FDM. Join me. One argument against the fascial distortion model is that there's not enough research to support the use of the model. Now, anecdotal evidence has never been very effective at convincing our colleagues that the fascial distortion model is worth, or any model is worth using. However, thousands and thousands of patients over the past 10 years and the growth of my own clinic tell me that anecdotal evidence should be fairly compelling. Now, many of us have had a personal treatment that throws out all of our concern about evidence-based medicine. Now, evidence-based medicine is very important and we should all strive to work within that evidence-based realm. But we don't want to kid ourselves in thinking that what we are doing in healthcare is evidence-based. Such a small portion of what we do is evidence-based. But that doesn't mean we shouldn't strive for it. Now, as I've said before, I've been teaching the FDM for 10 years. So why isn't there a ton of research material? Why isn't there study after study? 10 years is a long time. Why haven't I done that? Well, I'm a clinician. I work in the clinic. I see patients on an almost daily basis. And if I'm not out teaching, I'm in the clinic seeing patients. So my passion is spreading the model, giving that power to other practitioners, which allows you to use your hands to fix people. And the thing that recharges my batteries is that you email me, text me, and you say, hey, I had this success with this patient that I can't believe. And it just is empowering and it's rejuvenating for me. Do I want research? Absolutely. Do I have time for research? Well, that's difficult. Now, I have the pleasure of having med students in our clinic, and we've had attempts at research. Some have gone better than others. One of the things, though, that you learn quickly is that research is a real time commitment. One of our students spent over a year getting a back pain project using the FDM through an IRB. That was the year she had that she could commit to research. And then the project got passed on to the next class. Unfortunately, the passion for that project just wasn't there. So a year's effort to try to get it through the IRB. Fortunately, there are people who are committed to getting the research moving forward. Dr. Josh Boucher has a wonderful study on heel pain that we should be expecting out in one of the journals soon. There's currently an ER study on lower extremity pain that's being conducted. These studies are going to be pivotal at getting people to understand the fascial distortion model. The article that's most easy to find on the fascial distortion model is what's called a perspective study. And what is a perspective study? Well, in summary, it's an opinion. That's not really science, is it? But it gets published and people review it and see it and say, oh, the fascial distortion model doesn't have good evidence to support it, based on someone's opinion. Now, I am the first to agree we need more evidence. We need more people who are interested in the fascial research, the fascial distortion research. If you're interested in that, please contact the FDM A and Dr. Josh Boucher, who's our scientific liaison. We want to be doing more research. I'm in the unfortunate position that as an author of an introductory book and as a textbook, would you listen to me if I published a research paper? I would be cautious, I would be nervous, so I can't really be the instructor or the teacher of the model and have equal credibility as a researcher. We want the perception that this is independent, this is not biased. Now, I'm willing and happy to help anybody interested in research, but that's really not my role. As part of FDM Academy, my job is to spread the FDM to you and to your colleagues in all specialties. I want you to help me spread the FDM throughout family medicine, emergency medicine, physical therapy, athletic training, and the chiropractic field. Any specialty dealing with musculoskeletal pain. And if you're interested in research and continuing the spread of FDM, please, like I said, contact the AFDMA at afdma.com and reach out to us so that we can get you the information you may need. Thanks, and until next time, stay in the model.